Hi, this is Dr. David Tenner from the Goldberg Clinic, where we specialize in chronic disease reversal. Today we're going to talk a little bit about antacids. Most Americans have used antacids at least once in their lifetime. Many people actually take them every single day. What most don't recognize, however, is that antacids and other digestive drugs are not in fact harmless and oftentimes result in much more significant health problems, which we've seen many times with patients who have sought our assistance. These would include conditions such as severe gastrointestinal disorders, other systemic problems, including allergy and autoimmunity. In fact, antacids often do much more harm than good. Antacids do more than actually neutralize the acid in your stomach. They neutralize or essentially destroy your ability to properly digest food, particularly the proteins. Stomach acid is absolutely necessary for proper protein digestion. If that acid gets neutralized, digestion essentially halts. The maldigestion of proteins causes them to putrefy or essentially rot in your gut, causing the bowel to become toxic over time. You get the buildup of toxic materials, including things like indicans, scatols, putrescine, cadaverine, and other waste products of protein maldigestion. The lack of acid also disrupts what's called the onset of the alkaline tide, which is needed to activate digestive enzymes in the small intestine. Antacids also reduce the ability for the body to effectively utilize calcium and other minerals. The acid in the stomach works to make the minerals we ingest soluble. Without the acid, we're at a much greater risk for developing conditions such as osteoporosis over time. And studies have shown that long-term use of certain antacid or acid blockers increases the risk of hip fracture by 44%. Larry the Cable Guy fails to mention that on his Nexium commercials. The hydrochloric acid does more than digest proteins and make our minerals soluble. It also acts as a protective barrier for the body. Each time we ingest food, we also ingest a variety of bacteria and other potentially hazardous pathogens. The acid in the stomach destroys these dangerous bugs and prevents them from entering the small intestine. But when the stomach acid is neutralized, the protective barrier is no longer there. These invaders can get into your intestinal tract. Over time, abnormal and pathogenic bacteria begin growing in the GI tract, leading to a variety of symptoms and greatly increasing the risk for severe gastrointestinal dysfunction and systemic illnesses, including those involving allergy and autoimmunity, to set in. The use of antacids is generally a recipe for disaster. Over half the patients that we see at the clinic are currently taking acid blockers when they come in to see us at their initial visit. The resulting gut dysfunction that occurs following the use of acid blockers has for many of them contributed to the onset of very severe health problems, including things like rheumatoid arthritis, lupus, fibromyalgia, chronic fatigue syndrome, chronic skin conditions, allergies, just to name a few. And few are aware of the relationship between the antacid they've taken, sometimes for years, and the chronic health issues that they now have.